The debate over school reopening centers around vaccines and safety. For insight into the medical issues involved in this debate, we'll bring in infectious disease expert and Johns Hopkins scholar, Dr. Amesh Adalja. Dr. Adalja, thank you so much for being here today. As you know, CDC Director Rochelle Walensky this week said that the data is pointing to the fact that not every teacher needs to be vaccinated in order for schools to begin in-person learning. That was walked back by the White House just a day later, saying that the doctor was speaking in her personal capacity. I want folks to see the tweet that you put up in response to that. You wrote, quote, "The Biden administration should stand by the science that their CDC director based her comments on. Politicians and their spokespeople trying to undermine her intellect and analysis by saying it was in her personal capacity is disingenuous and wrong." So, doctor, what would you say parents should take away from this less than clear message coming from the administration?
What I think parents should think about is looking at the data that we're seeing from schools that have opened all around the country and all around the world, and trying to understand, is a school a focus for transmission, the educational component of it, not the sports, not the extracurricular activities. And I do think that the data does show that schools can be open safely with certain safeguards in place, with capacity restrictions and social distancing. And it's important for vulnerable teachers, those that are falling in the high-risk groups, to be vaccinated, but it shouldn't be a prerequisite to open schools. Indeed, we've opened schools in parts of the country without teachers being vaccinated. So I don't want vaccinations to become an obstacle to opening schools, because we know that children are suffering when schools are closed. We know that there's data that shows that this can be done safely. And now the current CDC director and the CDC director before her have both really stated that this can be done safely. So I think that we need to really make this a priority. Schools should be the first things to open and the last things to close. That's what people like Dr. Fauci, Dr. Walensky, Dr. Redfield have said, that this should be the norm, to have schools open during this pandemic based on the epidemiology, based on the science.
How much does this type of disagreement that's happening of schools actually opening up in person, does it slow it down dramatically, or is it just an insignificant blip?
I do think we're going to start to see significant delays in opening schools. Schools that are already open, I think, will stay open, but I see just in general now the rhetoric is changing a little bit, especially with the way the teachers' unions have been looking at vaccination as their major factor to go back to schools. We're seeing this happen in major cities. So I do think that there's probably going to be a delay, but I wish the administration would follow what the CDC director is saying and not try and discount it as something that's in her personal capacity, because I actually trust her personal capacity better than most people's personal capacity. And that's exactly why she is CDC director, because her analysis in her personal capacity as an infectious disease physician is spot on based on the science. So I think we should move forward, and I would like to see that the Biden administration follow through on opening schools within the first 100 days, as they've stated. I think this is doable and it needs to be done.
And as we are seeing all of this unfold, we are also seeing an increasing number of variants that are coming into this country. I want to put up some of the information on that so folks can take a look here. You have the UK variant cases coming in. You have 2 from Brazil, South Africa, and then we have the total number of cases in the United States right now, more than 26 million. So my question to you is, how concerned should people be about this variant? What are the dangers and distinctions here that folks should keep in mind?
So these variants likely have the ability to transmit more efficiently. That means that we have to be better at wearing our face coverings, washing our hands, avoided crowded and congregated places. It doesn't transmit any differently, just more efficiently. And we don't think that it's more deadly. Some of the variants, including the South African and Brazilian variants, may decrease the efficacy of our vaccines, but not for severe disease. So if you look at Johnson & Johnson and the Novavax vaccines that did trials in South Africa, their ability to block serious illness, hospitalization, and death was really undeterred by this variant. You still got infected, but you weren't getting the severe consequences. And that's the important message, that our vaccines are the solution to these variants. Mm-hmm. And the fact that these variants are here in the United States and spreading means that we have to move forward with vaccination with no speed limit. We basically have to get vaccine into people's arms as quickly as possible. Right. And that's going to be the way we move forward.
Dr. Adalja, we appreciate your expertise today. Thank you.
Thank you.